Welcome to the Probate Nation. My name is Richard Ruddy. You know, as you get close to the age of 65, there are critical Medicare decisions to be made. These decisions, if not carefully evaluated, can end up being costly mistakes that you cannot fix. On the other hand, if you are already in Medicare, there may be some options you ought to consider that could improve your health care coverage. Our show tonight begins with an overview of what Medicare does cover, the importance of Medigap insurance to cover what Medicare does not cover, and the prescription drug coverage under Part D. We will learn about the potentially attractive alternative of Medicare Advantage plans. We're very happy to have a delightfully and talented guest who is the owner of the Medicare Coach, a firm that provides independent advice to seniors and their advisors on how to get the most out of Medicare coverage. She also runs a Medicare concierge and boot camp program to educate folks on Medicare options, pitfalls to avoid, and tips on decisions to be made. She is a graduate of the University of Kansas, and prior to working for the Medicare Coach, she worked as a risk manager for Goldman Sachs. Please welcome Emily Gang, president of the Medicare Coach. So, Emily, I got to tell you, before we even get started, I saw that introduction that you're from Kansas, and I immediately came to mind about those rules of basketball that went up for sale. So were you involved at all with trying to help purchase those?
I wish I was. Unfortunately, I was not, but I'm very grateful to have those at the school. They're so neat to see, and again, such a great story behind them.
It really was a huge story. It was just a delightful effort on their part to make it all happen. But listen, let's get down to business here because you've got some great information. Let's begin with having you give us introduction to Medicare. Tell me, what is Medicare?
Yeah, absolutely. That's a good question because there's a lot of confusion around that. But Medicare is the main healthcare system in the U.S. and in America for people mainly for people 65 and over. So it's that health insurance that was created initially back in July of 1965 when a bill was signed by President Lyndon B. Johnson, because back then people 65 and over were having a really hard time getting health insurance. So it's the program that exists to ensure that people 65 and over do have access to health care in our country, because that has not always been the case. And then it was expanded over the years to kind of include other parts of Medicare, whether it be people with Social Security disability or end-stage renal disease or other things of that nature. But it's really this unique healthcare system that's mainly for people 65 and over.
So I mean, I'm on Medicare, so I have a little bit of knowledge, which probably makes me dangerous. So what does Part A cover?
Yeah, great question. There's all these letters that
yes.
Really confusing.
It is like an alphabet soup.
It is, and there's multiple letters of things. But Medicare Part A is hospital. It's mainly hospital, inpatient hospital coverage, right? Inpatient hospital coverage, some skilled nursing. I don't want people to get confused between long-term care and Medicare Part A skilled nursing because it is different. But some skilled nursing, some mental health, hospice, things like that. So Medicare Part A doesn't cover a ton of things, but it does cover this kind of unique inpatient hospital, usually some skilled nursing as well as hospice.
And then we go to Part B. What does that pick up then? That's
right.
Different apparently.
It is, and Part B is what most of us think about when it comes to healthcare. So it's what covers us in the doctor's offices. It's going to cover our durable medical equipment. It's going to cover our lab services, our physical therapy. Medicare Part B covers most of our healthcare needs, and it's really the main part, again, of what we use when it comes to Medicare.
Okay, so as we go and look down now at Medicare coverage, what does Medicare Part A cover 100%?
Yeah, good question. For most of it, no. There are different deductibles depending on the types of service that you have. I think that's one of the biggest misconceptions is that, Medicare is going to cover everything and all the costs, and it doesn't. So Medicare basically covers medically necessary services, but it might not cover 100% of those services.
So if it's not covered, how do people pay for the amount that's not covered?
Yeah, and that's why Medicare Advantage as well as Medigap plans, which are also called supplement plans, exist.
Okay.
So these other plans basically come in to protect people's out-of-pocket costs, right? Because especially on Medicare Part B, where it's only covering 80% of the cost, and you are responsible for 20%, that 20% can get really expensive, especially when you have a lot of tests being ran or have cancer, some other serious health issue. And so these other Advantage plans or Medigap plans come and really protect us financially, so that we're not paying an absorbent amount of money when it comes to our healthcare when we do have those costs.
How about prescription costs, though? Is that covered by Medicare Part A and B?
Yeah, and there's been a lot of chat about prescription costs on Medicare. I mean, over the years, especially, but especially in the last few months. But Medicare will cover medications that must be administered by a medical professional. So Medicare Part A or B will cover a very small amount of medications, but all the medications that you get from a pharmacy is not covered by Medicare Part A or B. Medicare Part D, as in drug, was actually created to cover those medications that you do pick up from a pharmacy. So adding to the chaos of Medicare, we have also have Medicare Part D to cover those medications. So it gets a bit messy.
It certainly does. So, and again, I gather we have these other tools to cover what might not be covered as we start down the list of Medicare options. How does Medicare, traditional Medicare, with that sort of combination of A and B and the D section, how does that compare with Medicare Advantage? Just kind of what is the major differences?
Yeah, in some ways it's like comparing apples to oranges. They are actually quite different. Both paths, no matter which one you're on, is required to cover certain services. So whether you're on that traditional Medicare route where you have A and B, and you likely have a drug plan and a Medigap plan, versus Medicare Advantage, you're going to have similar coverage levels, at least similar requirements, right? They have to cover the same amount. But there's a lot of details in there, right? And we probably can't go into all of it now, but Advantage plans will have copays. They tend to work like HMOs or PPOs. They tend to have networks. They might have extra benefits like vision, dental, drug coverage, all these other things in there. While traditional Medicare is different. I mean, you tend to have lower copays on traditional Medicare if you have a Medigap plan. But I guess my point is, while they're similar coverage, they're actually quite different in the way that they're used and the benefits that you have and the total cost that you pay when it comes to your health care.
So, so generally Medicare, you have to jump into that when you're age 65. Okay, so is there any way that you can delay joining Medicare is that possible?
It's a great question because you probably got these too, Richard. You get these scary letters in the mail saying, you know, and my parents got these, right? It says you have to join Medicare at 65 or you may face penalties. Well, that's a really big may that the government doesn't always explain, and it can be really hard to find out because insurance companies aren't really incentivized to kind of inform you of the rules. But the reality is you can delay Medicare past 65. You can delay Medicare past 65 without penalties if you have an employer health insurance plan. It could be yours or a spouse's, which meets certain Medicare rules. And so I think it's so important for people to be thoughtful around when is the right time to join Medicare. And do they really join it at 65 or do they have an employer health plan in which makes sense to delay it? I have seen people who join Medicare at 65, all parts of Medicare at 65, and they also stay on an employer plan. And it's a huge issue because one, it can waste thousands and thousands of dollars. I had a doctor the other day who is in this situation. He's easily wasted $8,000 by paying for both. And number two, by doing that, you can actually get rid of some of your Medicare rights for when you eventually join Medicare in the future. And so it's really important for people to join Medicare at the right time and they understand what those rules are, because not doing so, again, can create a lot of waste when it comes to money. And it can also create a lot of issues later on with the options that they have when it comes to Medicare.
Now, a lot of people, of course, hitting 65, they're starting to also maybe to jump into Social Security and start to draw on that. Do you have to be on Social Security to join Medicare?
You don't. And there's a lot of confusion on that as well. So there is one overlap, which says if you're drawing Social Security 4 months before your 65th birthday, you are required or you're automatically enrolled in Medicare Part A and B. Now, you can technically unenroll from Part B, but you have to at least keep Medicare Part A. But Medicare and Social Security are different programs, right? Medicare exists for healthcare reasons. Social Security exists for really income reasons. Medicare, you can get at 65 mainly. Social Security depends on your birth date, and people in that 65 area right now likely have a full retirement age of Social Security of 66 in a few months. So my point is, most people get them at different times, but that can create a lot of confusion for people because they see these different birth dates, they don't really know how it works or what to do. And so again, understanding that they're different programs and are treated as such can, I think, help people be thoughtful about when they should join both of them, because again, they are different decisions.
Well, we started talking, I'm going to switch over to the Medicare Part D for a second. So tell me a little bit about, again, what that is, and does the government pay for your prescription costs, or do you have to go out and get a company to pay for this prescription cost, a private company? How does that work?
Yeah, for most people, it's a privately issued prescription drug plan. Now, there are exceptions if you're on Medicaid or extra help that might be paying for some of these programs, but most people will be getting a plan issued by a private insurance company. And the plan that you pick depends on you. Most people in their zip code will have anywhere from, I'd say, 20 to maybe even 30 drug plans to pick from. Part D plans really only go with that traditional Medicare route. If you're on Medicare Advantage, it's different. But again, with these Part D plans, you'll get them through a private insurance company. And again, you're going to pick out a plan based on the medications that you take, based on the pharmacy that you see, based on where you live, and really find that plan with the lowest cost. I'm always amazed that you can take the exact, say, 4 medications and compare them against all the different 20 prescription plans, and it can range thousands and thousands of dollars. And so it's really important to be thoughtful. I mean, I don't like to waste money either, right? I think it's important to be thoughtful around your drug plan, because it's important to you and what you pay. And unfortunately, they don't make insurance companies a ton of money. And so people don't really usually hear about them. But I think drug plans are one of the most overlooked aspects of Medicare, for everyone. It's just so important, I think, whether you're on medications or not.
So can you elect not to have Part D and have drug prescription coverage?
Yeah, good question. You can, but there are penalties. So
Oh,
Medicare
ouch.
rules. I know. Medicare rules that by the time you're 65, you have to have a creditable drug plan, whether it's a Part D plan or an Advantage plan with drug coverage or even an employer plan. But they require you to have a creditable drug plan, or you will be penalized. Now, the penalties aren't as big as, say, a Medicare Part B penalty or other Medicare penalties, but the penalties still exist. And so I think it's important to be thoughtful around, is the penalty worthwhile, right? Are you better off in the penalty, or are you not? And I have certain clients who are better off facing the penalty than getting a Part D drug plan, but it's a very thoughtful decision, a thoughtful conversation. At what point we decide, yes, it probably makes more sense for you to have the penalty than a drug plan.
Well, that's very interesting. Now, we've been talking about, Part A and Part B and Part D, but I think I want to go ahead and turn to the Medigap coverage and begin to kind of talk about how that fills in some, but maybe not all, the holes that exist in those two particular programs. So can you explain the purpose behind the Medigap plan?
Sure. So for people who stay on the original Medicare path, it doesn't cover 100% of your costs. And mainly costs come from Medicare Part B that only cover 80% of the costs. So either you or a Medigap plan pay the other 20%. So Medigap plans are really important because they protect you financially. They create that max amount of pocket amount so that way you're not paying unlimited amounts to your health care.
Okay. So are these plans offered by the federal government, or do we have to go to a private insurance company?
Yeah, good question. They're offered by private insurance companies as well. And so you'll get these from some company. There's dozens of them in every area that will offer these types of plans.
Yeah, I get it. About this time of the year, I start to get all kind of notices, about inviting me to join a Medigap, either Medigap or Medicare Advantage. So, but tell me something. Can you offer any insights on how to evaluate and select a Medigap plan provider?
Absolutely. So I think at a very high level, there's different letters for Medigap plans. Start with A as an apple to N as in Nancy. and they have different coverage or different costs, different details. So I would say start to find that right letter. And then once you pick out that right letter, you can then find a company to buy that plan through.
Okay.
And the company that you pick should have a good financial rating, should have low history of rate hikes, good customer service, all of those details, because you could have this company and this plan for the rest of your life.
Yeah, we're going to get back to that. So when is the window which we can actually make these selections of the Medigap plan?
Yeah, it's usually within 6 months of when you first join Medicare Part B as in boy.
Okay.
So it's early.
And then if you don't select it then, when's the next time you can jump in?
Well, in most states, you can technically change supplement or Medigap plans at any time of the year, but in most states you actually have to go through medical underwriting in order to change supplement letters or companies, which means that they're going to ask you for your health history for the last few years, and if they don't see what they like, they're not going to approve you. So we had a client who was a marathon runner, very healthy, but he happened to have a kidney stone, and that kidney stone made him uninsurable and he couldn't switch plans. So you're not guaranteed to be able to switch plans in the future in most states anyway.
Okay, well that's important to know too. All right, let's go ahead and jump into the alternative that I think a lot of people look at, which is the Medicare Advantage plans. Okay, so can you tell me a little bit about what is a Medicare Advantage plan?
Sure. Advantage is also another name for Medicare Part C as in Charlie.
Oh, okay.
It's more, and we're filling up that alphabet. But Medicare Advantage plans are basically privatized Medicare. They're basically assigning the rights to a private insurance company, like a Blue Cross Blue Shield, an Aetna, a United Healthcare, whatever. There's so many out there. And they're the ones responsible for providing you the benefits based on what's approved through Medicare Part A and B. So they can determine the doctors and the hospitals that you can see. They tend to have co-pays on plans. They can have max out-of-pocket amounts of around $7,000 a year for in-network, but they have kind of their own unique rules when it comes to how you get your services and how the program is ran. So it is very different from that traditional Medicare route that so many people do take.
Now, are Medicare Advantage plans less costly than traditional Medicare?
So they tend to have lower premiums. So even if you're on Medicare Advantage, you have to have Medicare Part A and B, so we can't get around those costs. Advantage plans can be a lot cheaper when you're healthy, but when you do have health issues, they tend to have a lot more expenses, which can, again, quickly add up, and they can end up being more than what you'd pay on a traditional Medicare route. Okay,
so what are some of the key factors that someone should be considering when evaluating a Medicare Advantage plan?
Yeah, good question. I think it's important to think about your doctors both currently and in the future, because Advantage plans work like HMOs or PPOs. So we want to know, does your doctor even accept these plans? Are you planning on traveling? Are you moving states? What medications do you take? And just kind of the overall risk that you want to take for your healthcare and what you overall want to pay for your healthcare as well. So there's a lot of factors like that I think are important to take a look at to confirm if Medicare Advantage is really right for the individual.
So what happens, again, it sounds like we have a pool of doctors that we are limited to. So what happens if the doctor that my physician who's in the pool wants to refer me to is not in that particular pool? Can I still see them?
You could see them. You likely pay for them out of pocket, though, if they're not approved by the network inside of the program. So again, depends on the Advantage plan. Some will allow out-of-network doctors, some won't. But it can get really messy when you want to see a doctor who's not approved or not part of the Advantage plans network.
Okay, let's go ahead and drill down now on some of the common misunderstandings and pitfalls. So tell me a little bit about some of those things that you see that people run across with traditional Medicare, where they misunderstand something or they fall prey to some sort of misstep as they go along and try to sign up for Medicare.
Absolutely. I think one of the biggest things is around, again, the fact that Medicare does not cover 100% of your costs, and therefore Medigap plans exist, right? So people can join Medicare, they're not getting a Medigap plan, and now they have huge expenses that they can't really afford to pay. So that's one of the pitfalls. And I think secondly, to the point of the fact that Medigap plans have guarantee issuance rules, right? You can't just change things whenever you want to in the future. And so when you join it, you really need to get it right, because it can be hard to get later on.
And so on the other hand, what are some of those common misunderstandings and pitfalls people incur or run into with Medicare Advantage plans?
I think it goes back to the doctors that you can or cannot see, the cost of medications, and the fact that it can be hard if you first join an Advantage plan and you later want to go back to traditional Medicare. Again, most days it's really hard to make that change back, and so you can't just do whatever you want to do every single year. It's important to be thoughtful in the very beginning.
Okay, well, I think let's go ahead and drill down now on probably the thing that's most important, which is the cost comparisons. Tell us a little bit about, how does traditional Medicare, when you stack up all the things that you're supposed to get, compare with the cost of a Medicare Advantage plan? Are they cheaper, more expensive?
Yeah.
What are some of the things that come into play?
Absolutely. So again, in 2022, you have to pay Medicare Part A and B costs no matter what. So I really want to dig kind of more into the medication costs and the copays and things like that. So when my clients are on a traditional Medicare route with a Medicare Part D drug plan, as well as a Medigap plan, we usually estimate they're going to pay probably around $250 to $350 a month when it comes to their premiums. And their out-of-pocket costs are around $2,000 to $3,000 a year at most, excluding medication copays. So we kind of have a nice little box, more or less, when you're on traditional Medicare with all the parts. Now, on Medicare Advantage, though, I think the key thing to remember about Medicare Advantage is that the out-of-pocket, so the premiums can be zero on Medicare Advantage, but the out-of-pocket costs can be between around $6,000 to even $11,000 out of network. And so there's a lot more tail risk on Medicare Advantage that can impact your overall cost. I think what it's important to realize is that we can't just look at premiums when we're comparing costs. There's so much more to Medicare than simply premiums, and therefore we need to think about that total out-of-pocket risk when it comes to planning for your retirement and your kind of overall financial plan.
Okay, well, can you at this point, I think we're reaching towards the end of our program. Can you share some final thoughts, words of advice about traditional Medicare, Medigap, Medicare Advantage plans for our audience?
Yeah, I think that either can be right for individuals. I think it's just so important to be looking at it in the right way. I think people make the wrong Medicare decision because they see celebrities on the commercial, or they see, again, just advertisements about free this or free that without really knowing the full story. I think it's so important, because of how Medicare rules work, that you're thoughtful about it going into the beginning, not just about how to be sold a plan, but really the overarching aspect of Medicare and how it impacts you both now and in the future. And to get it right the first time, because again, if you're not really sure going to the first time when it comes to Medicare, you can be really surprised in the future, and you can't always undo those decisions.
Wow. Well, this is a lot of information. I'm sorry we didn't have more time to continue to talk. I hope that we could maybe have you come back and visit with us again, Emily. But I want to thank you so much for taking the time to talk with us today. Shared some great information. It's going to be very valuable for not only seniors, but as well as the conservators and people handling affairs for somebody with their power of attorney. So it's great information, and I want to thank you for this great public service.
Thanks for having me today, Richard.
You're very welcome. Boy, I tell you, Emily Gang, the Medicare coach, has really given you an excellent introduction to the Medicare options, including Medicare, plus Medigap insurance, plus the Part D prescription drug plans, and the comparison between the Medicare Advantage plans. Really, no one plan seems to be right for everyone, and there is much to consider before you make a decision. The key concern I come away from this Part 1 discussion is that some Medicare decisions cannot be changed, and that can prove costly in the years ahead. So I want to emphasize the importance of consulting with someone familiar with the intricate Medicare rules so you do not regret any of your decisions. I encourage you to tune in next week for Part 2 on Medicare, Medigap, and Medicare Advantage decisions. That show will highlight in detail the common Medicare selection mistakes and how to avoid them, as well as the difficulty of changing a Medicare Advantage plan decision. Tips to save money will also be discussed, and much more. This brings us to the conclusion of our show. I hope you found it helpful. Until next time, take care, live wisely, and be safe out there.